Hello and welcome to Healthy Nation and the Bodies exhibit in New York City. I'm Dr. Paul Knuffelmacher. You've heard the reasons why smoking is bad for your health, but have you really seen the reasons why? Smoking goes beyond the lungs, affecting all organs, and can even affect your sex life. In this segment, we'll be looking at the journey a cigarette takes from when you light it up to the moment you put it out, or as we call it, the anatomy of a drag. Everyone smokes for different reasons, but whatever the reason, know this. Before you start smoking, this is what your lungs look like. And after years of damage from smoking, they can turn black and look like these. Let's see how this happens. Upon taking a drag, the smoke enters your mouth, surrounding your teeth, gums, and tongue, until it enters your throat, eventually causing an abnormal thickening in the lining of the mouth and airways. This is linked to throat cancer. But not all the smoke goes to the lungs. Some goes into the nose and sinuses. And over time, smoking will decrease your sense of smell and taste too. When the smoke hits your lungs, your natural defenses are immediately weakened and more mucus is produced to protect the lungs from the toxins in the smoke. It becomes more and more difficult to fight viruses, colds, bacteria, and other respiratory illnesses. Your breathing rate increases, forcing your lungs to work harder to do less. The smoke will damage some of the air sacs where oxygen you breathe is transferred to your blood. And here's a little known fact. A pack-a-day smoker is pouring 1 cup or 8 ounces of tar into their lungs each year. The end result? 87% of lung cancer deaths. That's more than 137,000 people every year are caused by cigarette smoking. That's about enough people to fill 3 baseball stadiums to capacity. Now what about your heart, the hardest working organ in your body? Smoking makes it work even harder. Your heart will be forced to beat as much as 36,000 times more in a day than a non-smoker. And where is all that blood going your heart is working so hard to pump? First, it's being pushed through the blood vessels that have narrowed from the smoke. That drives your blood pressure up by 10 to 15%. And as you keep smoking, your risk of stroke and heart disease doubles. Smoking can also lead to a buildup of plaque and deposits in your blood vessels and can cause circulation problems in your arms and legs. Severe circulation problems can lead to an increased risk of amputation. Smoking can make your bones brittle. This is called osteoporosis and increases the risks of fractures or breaks. How about your sex life? Men who smoke can have more trouble getting and keeping an erection, and it can decrease your sperm count. And for women, smoking can decrease your ability to conceive and to stay pregnant. If you are pregnant and still smoking, your baby is more likely to be born prematurely, to be sick, or even to die. Okay, so we made it through the body, and there's so much going on inside, but we're not done yet. So what happens outside? Smoking constricts the blood vessels of the skin and reduces the oxygen it gets. So that means your skin is more vulnerable to wrinkling. Smoking can also lead to chronically cold hands and feet. When you smile, you'll be showing stained teeth. And when you smoke, you're hindering the saliva flow and function, which can lead to tooth decay. Smoking is also a major risk factor for cancers of the mouth. Along with your teeth, your fingernails may also turn a yellow stained color, and you'll be prone to rapid hair loss. Quitting is hard, but once you stop, whether you feel it or not, your body will start to heal immediately.